Hello and welcome to TLC Talks, Ask a Clinician. I'm Jen Monteleone, Interim Executive Director of the TLC Foundation for Body Focused Repetitive Behaviors. Thank you for joining us for this highly requested program today in recognition of Mental Health Awareness Month. Some quick housekeeping items before we get started. This is a 60-minute educational webinar offered in a safe and welcoming environment for everyone attending today. Leading our discussion are two experts in the field of body-focused repetitive behaviors, Dr. Suzanne Mouton-Odum and Dr. Hannah Garza. Dr. Mouton-Odum is a licensed psychologist who completed her doctoral residency at the University of Texas Medical School, Houston. Dr. Mouton-Odum is a clinical assistant professor at Baylor College of Medicine and president of PsychTech Limited, Technology for Psychology. Dr. Mouton-Odum serves as Vice President of the Board of Directors and Vice Chair of the Scientific Advisory Board for the TLC Foundation. Additionally, she is the past president of both the Texas Psychological Foundation and the Houston Psychological Association. Dr. Mouton-Odum has published numerous scientific journal articles, presents both internationally and at professional conferences, and is the co-author of 3 books. Dr. Hannah Garza is also a licensed clinical psychologist who completed her residency in clinical psychology at the University of Texas Health Science Center of San Antonio. Dr. Garza has expertise in cognitive behavioral therapy for adolescents, anxiety, hair pulling and skin picking, OCD, tic disorders, and interpersonal effectiveness. She is the recipient of TLC's 2018 Early Career Award. Welcome, panelists. Hello.
Hello.
Hi, how are
here.
you?
Good. We are so grateful to have you both here today, especially during Mental Health Awareness Month. So we ask community members to submit questions in advance, and I'm going to go off camera so that you two can answer those questions, and we'll get rolling.
All righty.
Okay. So here's the first question. We are new to the term BFRB and learning about our child's pulling, picking, chewing behaviors. They started around the time of the pandemic when school moved to a virtual platform. We thought it was temporary, knowing how kids respond differently to stress and anxiety, but it's only gotten worse, even being back in school. Do you have any tips for where to get started? Best reads, resources, types of therapy, courses of action?
I think it's such a common question that we're getting these days is, as kids went through the pandemic and online school and isolation from others, we saw BFRBs really blossom in many families. And it's hard to know if it was the pandemic and the situations that surrounded it that started the BFRB or if it would have happened anyway, but here we are in this situation and what are we going to do about it? So there are some really good books that Ruth Gollum and Sherry Vavracek wrote years ago, The Hair Pulling Habit in You, which is a fantastic workbook for kids. There are a host of other books that TLC probably lists on their website. But most importantly, I think it's understanding sort of, and Dr. Garza and I are going to talk a lot today about understanding BFRBs, both as a parent and as a person who has a BFRB, and sort of what we can do about them. So knowing that, getting some good education through books or webinars like this or the TLC Foundation, and also seeking help from a therapist. If there is one in your area or in your state who can do virtual therapy, I think is a good place to start.
Mm-hmm. I 100% agree, echo a lot of what Dr. Mouton-Odum is saying. Definitely use TLC as a resource. There are a lot of articles, updated information about research, videos, just really great resources on the TLC website, BFRB.org. So if you haven't already, you could spend all day looking at different information there and some of those resources. And a lot of books, I know Suzanne just mentioned a couple, but she and Ruth Gollum also wrote a parent's guide to hair pulling disorders. So for those of you who are parents and are not really sure where to start and are wanting some more information and to know how to help and not hurt, that's a great resource and a good place to get started to get some more information. And the TLC website also can help connect you with a provider in your area. So you can use that tab to try to find someone who has gone through training and is an expert in that area. So that's a really good place to start to get some more information. And finding a provider who does cognitive behavioral therapy, the COMB model, as well as HRT or other evidence-based CBT approaches, like acceptance and commitment therapy and DBT, if the provider also is aware of and understands how to treat BFRBs, that those are good treatments that might help narrow your search.
Thank you both. I might also recommend that folks take a look at the Getting Started guide on the TLC website. It's a really great resource to start understanding language and treatment options, and it's super easy to get to right on the homepage at BFRB.org. Next question is this: my skin picking is so up and down. I do well for a while, then I realize that I am picking again. Will I ever be able to stop?
So BFRBs tend to wax and wane over time. And I always giggle and say, sort of like my diet. I mean, it goes, I do really well for a while and I'm look around, I'm like, what the heck? It's not going so well. So we have to understand that behavior change is not linear. It doesn't just get better and better and better over time. It kind of goes like this. And so, if you look at the stages of change model, Prochaska and DiClemente, they actually describe it as kind of an upside down tornado, where you go through a cycle and you work really hard and you change your behavior and then you relapse and you go up a level. And then you go through that whole cycle again, where you work really hard and you change your behavior and then you relapse and then you go up a level. And so each time it gets a little bit faster until you get to the end where you don't relapse anymore. And so know that it's a process and not a light switch, and understanding what worked for me last time and how can I learn from the past. I was doing great. And then what happened? Was it time of year? Was it an event? Was it an emotional kind of a change or a move, a transition? So really learning about your behavior, not only what works, but what happened around the time of relapse can be super instructive. So the next time you'll be ready for it.
Mm-hmm. Yep. I encourage my patients to be like a detective for their BFRB and to try to learn as much as they can about it, and to use any relapse or slip up as a learning opportunity. That way you can figure out what's going to work the best for you. I use the diet metaphor a lot too. You might be really good a lot of times of the year, and then you get to a birthday party and there's your favorite dessert right there in front of you, and it's so tempting and tricky, and it doesn't mean the whole rest of the year, those other months or days where you were doing really well on your diet, are all a wash. It's just, now what do we need to learn about this one special situation that made it tricky? So just learn, be flexible, continue to fine tune and tweak what you know is already working to incorporate the new information that you might learn with any kind of relapse or slip up.
Absolutely.
Great, thank you for that. Now we actually have a question about diet, exercise, energy work. And the question is this: do diets, exercise, energy work, and other things actually help BFRBs?
They might be great supplements to other kinds of treatments that do have more evidence in support of them, but probably not ones that should be relied on their own.
I think that's a great way to say it. And really, it's anything that supports you in your journey to happiness and mental well-being, I think can be helpful. But as Hannah said, not as a standalone with the expectation that this is going to help me stop pulling or picking. Although if it does, and that works for you, that's fantastic. I'm certainly not here to tell you that it can't. But we just haven't seen across the board in studies that those things on their own have helped, as Hannah said, a standalone intervention.
Wonderful, thank you. Okay, we have another question coming in from the community. I am 64 years old and started pulling around the age of 9 or 10. Is there any hope of stopping ever?
Great question. And the answer, I think, is absolutely yes. There's always hope of stopping. And I might take this opportunity to explain a little bit about treatment and what that would look like for this person who's been pulling for a great many years, or someone that's been pulling for just a couple of months, because the treatment is relevant to both, as well as sort of what gets a person to the table, which is not only motivation, but readiness for change, which I mentioned a little bit earlier. And it's tricky because with BFRBs, as with all behaviors, usually behaviors that we engage in that feel really, really good are typically not really good for us. And so they come with ambivalence. There's a part of me that wants to change my behavior, and there's a part of me that wants to keep doing it, which is the struggle. And so this person who's been pulling for so many years probably very well understands that. So that's one piece, is sort of a readiness for change. And then the other piece is really understanding, this is what we do in therapy, understanding sort of what goes into the behavior. And what we look at is antecedents and consequences. So what happened, what's going on before the behavior occurs that makes the behavior more likely to occur, and what happens after the behavior that makes the behavior more likely to occur. And these are typically something that's rewarding or reinforcing. And both antecedents and consequences can be internal, like feelings or sensations or thoughts, or external, like mirrors or tweezers or activities or places or bright lights. And so we want to look at all of those antecedents. So it may be that a person was watching television, feeling stressed, playing with their hair, laying on the couch, those being antecedents, a place and an activity, and maybe they feeling for a certain type of hair. And then a consequence might be feeling more relaxed or feeling really gratified by seeing, the little bulbs at the end of the hair. And so what all of this tells us is kind of the function of the behavior for that particular individual. So what we do know about BFRBs is that they're highly individualized, although we see commonalities, but no two people are exactly alike. So in treatment, you want to find someone who's going to do a comprehensive analysis of the behavior, looking at the antecedents and consequences, and really understanding how that behavior functions for that person in that environment. And then there may be another time of day, that same person might be at school, listening in a class, feeling bored, and might engage in a different BFRB. Maybe they're engaging in picking. So it can look very different for that same individual, given the different contexts, antecedents, and consequences, and environments. And so we want to understand all of that to be able to really tailor a treatment to help that person in the various situations in their life that tend to be associated with their BFRB. But as far as how long a person has engaged in their BFRB, does that predict how successful they'll be in treatment? Absolutely not. I've seen people who've just started pulling or picking have a really hard time changing their behavior. And I've seen people that have pulled for years work through treatment and be successful. So I don't think that is necessarily the deciding factor, how long it's been going on.
Mm-hmm. Yep, well said. The only other thing I would add is, and we kind of referenced this a bit earlier, that the treatment process has a lot of ups and downs. So, be patient with yourself and be forgiving of yourself, and be kind to yourself through that process.
Yeah, that's a great point, Hannah. The other thing I might throw out there, and obviously I don't know this person who asked the question, but sometimes if a behavior's been around for a long, long time, there's some bit of that that's become part of that person's identity. And there's a little bit of loss with letting go of it. I had one client tell me once it was like letting go, saying goodbye to an old friend, and so I might really ask myself, what will my life be like without my BFRB? And who will I be? Will I be different? How will I be? Sort of really imagining that and seeing if there's any resistance, because every once in a while we see some resistance in that it's letting go of something that's been such a part of a life for so many years. And if that's true, it doesn't mean that treatment can't be successful. It just means that you have to address those issues in order to be successful.
Another question has come in from community member. Would knuckle cracking be considered a BFRB? And could anxiety be the root cause of this behavior?
Knuckle cracking is definitely a BFRB. And, anxiety perhaps is a cause or could be related, but, the leading idea of thought is really that there's so many different factors that contribute. Could be, sensory experience. There could be, thoughts related or other contextual environmental factors related, where you might see, an increase or decrease in the knuckle cracking. So anxiety or emotional states could certainly influence BFRBs like knuckle cracking, but is not necessarily the only cause.
I 100% agree. And it's such a great question, and it speaks to the complexity of BFRBs. I would say that most everyone reports feeling anxious at least some of the time when engaging in their BFRB. But then just as soon as they say that, they'll say, but then I polar pick in a lot of other times too. And so it's almost always there, at least some of the time, but then universally, there are other times, places, cues, triggers that can lead to the behavior, whether it's knuckle cracking, hair pulling, skin picking, lip biting, cheek biting, or the rest of the umbrella of BFRBs.
Here's the next question from community. I've been pulling my hair out for more than 20 years. Each time it seems to grow back. I'm worried if I keep pulling that it won't grow back. Is there a chance of this happening?
I think that I have heard that is possible. I don't know that I've ever seen it in practice. I did meet one lady years and years ago who had pulled her whole life, and she had gone about 6 months without pulling, and it had not started growing. And she asked a dermatologist and was told, give it a year. It can take, hair that's been pulled for that long, the follicles get damaged, and they might take a little bit longer to sort of regenerate before they start growing again. But I know it can be a risk. And so it's something to think about. But I wouldn't give up if you've gone months and haven't seen new hair growth. I wouldn't give up and think, oh, it's not going to come back. I would give it at least a year, as the dermatologist said. I would also think about what are the other benefits of not engaging in a BFRB in addition to having your hair back or having skin healed, because I think that it's a broader sort of positive than just that outcome in terms of a sense of internal self-control, a sense of confidence, sort of having beat the challenge, self-esteem, lack of shame or decrease in shame. I think there are a lot of other outcomes that are important besides just the hair growing back, although I also understand that's a very important one for people.
Well said. I don't have anything to add.
Okay.
Okay, next question. For a while, I have observed a lot of OCD symptoms. Is this related in any way to hair pulling?
You want to take that one?
Sure. Yeah. So it is not considered OCD, but there it's like a cousin to OCD, we say. So, and even how we classify it, or we have a manual with conditions and how they're related. Technically, BFRBs are considered an obsessive compulsive related condition, or in that section. So it is related. It's not considered OCD but there is overlap. So repetitive behaviors, maybe in OCD, you might see someone, opening and closing the door several times. But there's usually some kind of feared outcome in OCD. Like if I don't open and close the door several times, then, something dangerous is going to happen to me or someone I care about, for instance. And in hair pulling, there's not really, or in BFRBs, there's not that same kind of feared outcome, that if I don't pull my hair, something bad will happen. So they're related. They have some similarities genetically. They can cluster together within families. And so you can sometimes see one family member with OCD and another family member with a BFRB. But again, they're not, a BFRB is not considered OCD.
But it is possible to have both.
Mm-hmm.
And so if the nature of this question is, I have a BFRB and I also am now developing some symptoms of OCD, or I'm noticing that I also have some symptoms of OCD, is absolutely worth getting treatment for both. And the treatments tend to be a little bit different, although there is some crossover, but it's, exposure response prevention is the treatment of choice for OCD. And so you'd want to definitely seek out a therapist that knows how to do that kind of treatment, or to make sure that that's what you're dealing with. And also looking at, is the nature of the OCD about hair pulling? Because there's one other disorder, which is compulsive hair cutting or shaving, which can also be confusing. And so I'd want to know a little bit more, but it's definitely possible to have both. And as Hannah said, they are, BFRBs are not the same thing as OCD, although that's oftentimes a misunderstanding, but they're a related disorder.
A parent has written in asking, our 7-year-old eats their shoulder length hair, not just the bulb, and we are doing our best to redirect. When they only consume the root, we're not as concerned, but now that they are eating the whole hair, we're constantly worried. Any advice you can give is appreciated.
Yeah, I think you have reason to be concerned, when there is ingestion of a hair, especially longer hair, then it can relate to medical problems. So I would recommend getting medically evaluated if you haven't already, and to monitor with a physician, just to make sure that you're treating if there is maybe a hair clump or some kind of restriction happening in the organs because of the hair. That can be very dangerous and serious. So you definitely want to get a medical provider on board to help out. And if you haven't already, also engaging in therapy and treatment to try to reduce the behavior.
100% agree. It definitely would get a physician consultation, a GI consultation specifically, and I would definitely get your child into therapy with a knowledgeable treatment provider.
We have time for just a couple more questions. The next question is, due to a few reasons, it's not possible for me to seek professional medical advice for my severe hair pulling. What can I do without assistance from a clinician or medical provider to support myself?
Well, there are a lot of resources. We referenced a few of them earlier, but use the TLC website. There are lots of books and self-help books, workbooks that you can use. There are a lot of online resources for doing your own tracking of your BFRB and tips about ways to treat it or work with it to help manage it. So there are a lot of resources that you can go to on your own without having to use a provider that are available to you.
Yeah, one book that recently came out, I think it was a couple of years ago, Overcoming Your Body-Focused Repetitive Behavior. And it really goes through function-based treatment, which I referenced earlier, and the co-model, which Hannah talked about, that looks at the different dimensions of hair pulling and skin picking that we pay attention to, or the different domains, which are sensory, cognitive, affective, motor, and place. And as I mentioned earlier, all of those can apply to both antecedents and consequences that are reinforcing, that keep the behavior alive. And so really working through some of those workbooks and self-help books could be a really good option, or websites, and taking the first step in learning about your BFRB, trying to understand it. And as Hannah said, which I love, seeing yourself being a detective, and you're studying yourself essentially, and trying to understand the who, what, when, where, why, and how of your behavior, and trying to decrease the judgment and decrease the shame, and seeing this as similar to so many other behaviors that people engage in that aren't ultimately good for them, or have negative consequences down the road, but feel really good in the moment. And so those are harder to change, because they provide some level of satisfaction in that moment. And that may not be true for everyone. So I'm not saying that's true for everyone, but most people will report that there is some, whether it decreases a negative or it increases a positive sensation or thought or emotion or experience, that makes the behavior one that people go back to over and over and over. And so learning that about oneself can really lead to answers of how can one get that need met in a different way, in a less destructive or damaging or unhelpful way, ultimately, that doesn't cause the hair or the skin to change, or potentially, give a person medical consequences that are unwanted.
Mm-hmm. I also recommend, getting socially connected if it is feeling supportive and helpful, and it's reinforcing your journey and progress in a good way. Then that might be another avenue to connect with other people, trade ideas of other strategies or techniques that have worked for them, that might also work for you.
I think you bring up a really good point, Hannah, about social support for people who struggle with BFRBs, and also really for parents. And I know there were a couple of questions at the beginning regarding parents and them dealing with a child, and even, it's just, this is a new behavior. What do we do? How do we handle this? So connecting with other parents, getting education is so important, but also realizing this is really hard for parents. And having compassion for yourself, as Hannah was talking about, it's hard. I honestly think that BFRBs are harder on parents oftentimes than they are on the children. And we hear this over and over, parents saying, my child seems fine with their BFRB. They don't seem to care, but I care. And sometimes in therapy, that looks like the therapist helping the parent and supporting them and helping them be a support to their child, rather than the parent having to fix it. And it's hard because as parents, that's our job, right? Is to help our kids and to help problem solve and fix things. And it feels really wrong to just support our child when they're struggling with the behavior that we feel like should go away or change. And so I do a lot of work of helping parents to be helpful for their children, so that their children can eventually get on board and get interested in changing their behavior. But again, it's a process, and it can be a frustrating one for families.
Thank you both. I'm wondering before we wrap up today if we can answer a question that is asked regularly in community and has been a question coming in quite frequently to TLC given recent publicity around BFRBs. And that question is, are BFRBs self-harm?
Oh, no, they're not considered self-harm. That's I think, a myth or misconception about them. There's no intent to hurt yourself or feel pain or anything like that that we might otherwise think of as being driven by self-harm. So it's really about looking at the function of the behavior, and it's really not intended to be harmful. That is maybe a consequence, that there is damage to the skin or the hair is pulled out. But hair pulling or BFRBs are not in and of themselves considered self-harm. But much like we were saying about OCD, sometimes folks can self-harm and have a BFRB. So those might be two different kinds of behaviors with two different functions. But typically we don't think of BFRBs as a form of self-harm in and of themselves.
But it's a great point, and I'm glad you brought it up, Jen, because it's oftentimes an assumption that this is a form or will lead to self-harm or self-harming behaviors, which we also don't see as, that BFRBs are leading to anything actually. And so we have to be careful, because I think what comes with that is blame and kind of a very negative attitude. And so I, like the function-based conceptualization, because it really is more positive. It sees it more as a behavior that's performing a function, and we just have to figure out another way to get that function met or that need met that doesn't cause the negative outcome. But other misconceptions or misunderstandings about BFRBs, in addition to the one that we talked about earlier, that they have the same thing as OCD, or that they're self-mutilation or self-harm, is that they are sort of the manifestation of some deep, dark underlying psychopathology. And if we could just figure it out and get to the root of the problem, no pun intended, that we would cure the BFRB. And we do not see this as a viable understanding of BFRBs. Many, many, many people with BFRBs are incredibly high functioning people that had lovely childhoods, have no history of abuse, had good parents, and they still pull their hair, pick their skin. So we can't make assumptions about a person based on that behavior alone, and I mentioned another assumption, which is that you've had some sort of trauma or sexual abuse. And parents come into my office all the time asking me, what happened to my child? Oh my gosh, they're pulling their hair out or picking their skin. Did something happen to my child? And I can't say something bad didn't happen to their child, but that's not why they're pulling or picking. And so we have to be really careful with these assumptions, that this means something and that it's a sign of something. And really, I like to describe it more as a self-regulatory behavior. And it's a behavior that a person engages in certain environments or in response to certain activities or sensations or experiences that either increase a positive or decrease a negative. And in that way, they get reinforced. And they tend to happen again. Now, we have to be careful, because one thing that reinforces all behavior is attention. And when we give attention to a behavior, oftentimes we see that behavior grow stronger. And so from parents' perspective, I always tell parents, if you're in the garden, you want to fertilize the flowers, not the weeds. So what that looks like in parenting is we really want to focus on behaviors that we do want to see again, not behaviors we don't want to see again. And parents can get real stuck on the negative. And I know I've done it before too. It's an easy trap for parents to fall into. The don't do this and don't do that and quit doing this, instead of, oh my gosh, I love it when you do that. And I love the way you do this. And I love the way you do that. So we really want to fertilize the flowers, not the weeds. And this is a common family dynamic that happens. And parents get stuck in this very negative pattern that creates terrible feelings on the part of the child. And it's nobody's fault. It's not like parents are trying to be bad parents. It's not that. It's an attempt to help. We want to help our child. So we're going to remind them when they're doing the behavior, and then they're not changing their behavior. And now we're getting frustrated, or they're telling me they're not engaging in their behavior when I see it happening and I know they're doing it. And so it can lead to a lot of negative interactions. And so part of it is really taking a step back and changing those dynamics with the help of a therapist or not. And so anyway, I said a lot about that, but those are all common myths and misconceptions that I like to clear up.
Yeah, only thing I would add to that too, or with the idea of fertilizing the flowers and not the weeds, is even, as much as, you want to encourage your child, I would focus the flowers being their, maybe dedication to the treatment, or their use of strategies, or other things that are really awesome and fun about them, like, that they like art, or they're creative, or, whatever it may be, and really fostering those kinds of strengths. A trap I see parents fall into sometimes is complimenting, oh, I see the hair's growing in, or really focusing on the, they're trying to be positive and focusing on the growth, but that sort of inadvertently sends a message that, you get this positive attention when you're, when the outcome is good, and you don't necessarily get positive attention when the outcome is not good. And we don't want to send our kids those messages. So focusing on their strengths, whether or not there's hair pulling at all. And when it comes to positive reinforcement with hair pulling, that it's really a focus on what they have control over, like using the strategies, or going to therapy, or monitoring the behavior and reinforcing that.
Yep. And I love how you pointed out, or just all the cool things about them.
Mm-hmm.
Because all of our kids have so many amazing, wonderful qualities above and beyond a BFRB. And that's really a better place to put the attention. I had one parent tell me once that she felt like her role was to be the soft pillow for her child. And I love that. It's like the support, the care, the concern, and the love. And that's really what our kids need. Even with a BFRB, that's, in fact, more so with the BFRB. So that they don't internalize the negative, the shame, the disappointment that can oftentimes get internalized.
That is a beautiful place to stop for today. Thank you both.
Of course.
Happy to be here. Thanks for inviting us.
We are so appreciative for your dedication to our community and for your willingness to give of your time and talents today. Thank you. Thank you. To the TLC staff for putting this event together, and to all of you for tuning in to this important conversation. Thank you so much. If you appreciated the content of this webinar today, please consider making a donation to support our programming so we can continue to provide additional community health education opportunities like this one. You can make a donation now at bfrb.org/donate. We look forward to seeing you all again very soon. Thanks again for joining us today. Bye-bye.
Thank you. Bye-bye.
Thanks. Bye.